Yeah, as Christina has highlighted the importance of nutrition in the workplace, we wanted to explore whether nutrition is already being recognized as part of protecting workers' health. So, one way to examine this is through collective bargaining agreements or CBAs. CBAs are written agreements between employers and workers to set out employment terms or working conditions. And we choose CBAs because they are an important mechanism for shaping workplace policies. However, their role as a tool for health promotions remains relatively under-researched. Therefore, our study aimed to explore the extent to which collective agreements from around the world include clauses related to worker nutrition. So to conduct this study, we first carried out web-based and bibliographic search to identify relevant CBA database. In total, we found 1 global database, 6 national database, and 1 sector-specific database. And after applying our selection criteria, retain 3 databases for the analysis. First is the WageIndicator, second is France, and the US OPM. Together, these contain more than 26,000 CBAs. So for the WageIndicator database, it was analyzed using pre-coded variables, while France and US OPM were analyzed using keyword search. So it is important to note that there may be some overlap because WageIndicator also includes agreements from France and the United States. And for the analysis, we group our search terms into 2 categories. So first is the direct nutrition reference, meaning clauses that explicitly mention nutrition, such as healthy meal or balanced diet. And the second category was indirect nutrition related provisions. These are clauses that may support nutrition outcomes, but do not explicitly mention nutrition, such as meal allowance or meal breaks. Yeah, to define workforce nutrition, we use the workforce nutrition pillars developed by GAIN as our analytical framework. And the first pillar is healthy food at work, which focus on improving access to healthy and nutritious food through canteens, healthy snack offerings, or related initiatives. And then the second pillar is breastfeeding support, which includes all measurements to help mothers to continue breastfeed, such as maternity leave, lactation rooms, flexible working arrangement, and awareness initiatives. And for the third pillar is nutrition-focused health checks, which involve assessing nutrition-related health risks through screenings, nutrition counseling, and follow-up support. And last is nutrition education, which aims to improve knowledge and skills that help employees to make healthier diets and lifestyle choices. So these 4 pillars guided our definition of workforce nutrition throughout the study. Yeah, so this slide represent the overall research results across the 3 databases. So at the top, you can see the total number of CBAs screened from each database. And the lower sections shows the total number of mentions identified for all nutrition-related variables and keywords included in analysis. And the key finding here is that direct nutrition reference were relatively rare across all the database, and in contrast, indirect nutrition-related provisions appeared much more frequently. Yeah, and this slide provides a closer look at selected keywords and variables from our analysis. We purposely selected these examples to illustrate the contrast between direct and indirect nutrition-related provisions. And the white rows represent direct nutrition reference, while the yellow represents indirect nutrition-related provisions. So overall, direct nutrition reference appeared much less frequently than indirect nutrition-related provisions. So most direct nutrition reference receive very limited attention. For example, here, the term nutrition appeared in less than half a percent of agreement in France database. And similarly, such terms such as balanced meal, balanced diet, and breastfeeding break did not appear at all in the US OPM database. However, if you see here, breastfeeding support was an exception for the breastfeeding support pillar, because in the WageIndicator database, about 80% of CBAs included clauses on breastfeeding breaks or facilities. And even around 11% specifically stated that these breaks were paid. And lastly, although explicit nutrition reference were uncommon, several indirect nutrition-related provisions were frequently included. For example, more than 84% in the CBA's wage indicator data wage indicator database contain health or medical assistance for employees, and nearly half included maternity leave provisions. Yeah. When we compare the four workforce nutrition pillars, breastfeeding support emerged as the pillar receiving the greatest attention across CBAs. And in contrast, nutrition education was the least represented pillar, with very few agreements containing explicit reference to nutrition education initiatives. And this suggests that workforce nutrition is most commonly addressed through maternal health related provisions rather than through broader nutrition promotion activities. Yeah. So in addition to the quantitative analysis, we also conducted a qualitative review of selected CBAs that contain nutrition-related content. So we selected examples from different WHO regions and different industries to illustrate the range of provisions we identified. So, for example, here we have a collective agreement from textiles industry in Indonesia that explicitly stated that meals provided to workers should be healthy and nutritious, and even they mentioned explicitly that it should be aligned with the health standards. So this is a very good example of how direct nutrition refers in within a CBA. And for breastfeeding support, a collective agreement from the transport sector in Kenya included provisions for paid maternity leave and guaranteed that workers will not lose employment privilege while on leave. I think although these clauses do not explicitly mention nutrition, but they support breastfeeding and maternal health outcomes indirectly. Yeah. This is from the United States, a healthcare sector agreement included preventive health screenings for conditions such as anemia, blood cholesterol level, and diabetes. This illustrates like how nutrition can be addressed through workplace health checks. And lastly, a collective agreement from the mining sector in France referred to nutrition as a part of health advice and workplace training activities. This demonstrates how nutrition can also be integrated into employee education and awareness program. Yeah, and these are three key takeaways. So first, direct reference to nutrition in CBAs remain rare. And the second is nutrition-related provisions such as meal allowance, maternity leave, and health support are much more common. And third is breastfeeding support is the workforce nutrition pillar that most frequently addressed across agreements. So together, this finding suggests that nutrition is already presented in many agreements, but often in implicit way rather than explicit way. Like any study, this research has both strengths and limitations. One of the key strengths is that, to our knowledge, this is the first study to specifically examine nutrition in collective agreements. And another strength is our collaboration with the Wage Indicator, which we are very much grateful for, because this collaboration enabled us to analyze this across cross database analysis. And in addition, our use of both direct and indirect nutrition-related search terms allowed us to identify not only existing nutrition provisions, but also opportunities for strengthening nutrition integration in CBAs. However, there are also some limitations. So for some database, we could not include them because of access restrictions or limited search functionality. And also, because our analysis relied on keyword search, we may have missed some relevant clauses or capture clauses that were not directly relevant. And lastly, the language difference and translation challenge may have affected our interpretation of some agreements. And for future research recommendations, looking ahead, future research could expand to more countries and language, and compare results across sectors and regions, and then incorporate qualitative methods to complement the quantitative, and then track how nutrition provisions evolve around time. I think with that, I will hand over to Chioma. Thank you.
Thank you very much, Naila. Now we're going to focus on what is the way forward. Yes.